Thank you, sir, and thank you, madam, for all your time and the energy. I could see the energy when you have been staying for almost last 2 days. And as Narayan Prasad said, it's been fortunate to have you here. We are all blessed because in our generation also we had lot of fear and what they call hesitancy in approaching you. And now that I think our students are all blessed to have you, sir, and your
Most
blessings.
welcome.
Thank you,
very
sir.
much.
Thank you, sir.
Thank
And
you very
Gopalakrishna sir has been always there for us in whatever academic teachings are there. So, and thank you very much, sir. Morning you had come in the early morning and then you are going now. So, thank you for your valuable time, sir. I request all of you to please come forward. We'll have one token of gratitude, sir. I request Bhushan sir to please. Thank you, ma'am. Thank you. So any message you want to give to our students, because you have been listening for almost for the past 2 days? Any message, last message you want to give, not only for the examination but also for their future practice and life?
You are all very good students, and the only thing you have to modify, you have to frame your answers as if the examiner want. That is the point. You don't push your examiner to some area where you are not clear about. So you should be able to bring the examiner to your court. That is very important. And be thorough with the basics. If you are not thorough with the basics, the discussion will not go beyond that. So that will be a negative mark on you. Whatever newer trials you know, you have to reach there to discuss those trials, isn't it? So be sure with the basics. And you should talk authentically. As if once the question is asked, you have to be brave and answer authentically. So that the examiner feels that you know that area. He will go to some other area. Okay, otherwise stick on to that area where you are not able to go ahead. So you have to modify a little bit. All the best for your exams.
Sir,
I think ma'am has already emphasized the important things. So I think two things. One, which she already said, get your basics absolutely right, because that is what will decide whether you will pass or fail. You know, knowing the latest monoclonal antibody that is being tried in lupus nephritis, you don't know it. I'm not bothered. I'm not bothered. Even I don't remember those names. I find it difficult to remember those names. You know, names like Adam TS13. What is the full form of Adam TS13? You ask me right now, I'll stumble. You know, so that is not where you will fail, but your basics must be absolutely flawless. There, a mistake is not acceptable. And number two, when you are giving your differential diagnosis, for instance, if the differential diagnosis should be MCD followed by FSGS followed by minimal change, followed by membranous nephropathy, then the order must be correct. You saw that happening today, right? So in that situation, don't put MGN first. The examiner gets annoyed with that. So get your order. Similarly, if you are asked what are the causes of such and such condition, talk about the commonest cause first, not the rarest one. So that order of priority must be there. I think this is good enough, and all the best for your exams.
Thank you, sir, for your word of wisdom, sir. Can I request Gopalakrishna sir to please, sir?
First of all, thanks for the opportunity. I always feel happy to be in the midst of students, and so it was a good day for me. So hope you also enjoyed being examined. My simple advice is that on the day of examination, never think that it is a special day or different day. You just feel as if you are going into what? Like how you just do your work on a routine day. Instead of going into the what, you are going to a special room. That's all. If you have this kind of attitude, your original self will come out. So otherwise, most of the times the mistakes do happen because you are under stress. Don't feel stressed. So you should learn to enjoy being examined. So that's very important. Then automatically the confidence will be exuberant and whatever you know will be fine. Number two, the history, the pruning the history, putting it only the relevant information in a precise but comprehensive way. That's very important. Practice that way. It comes with practice. It just comes with practice. Two. Third thing is that before entering into the examiner's chamber after examining, don't try to recall the disease with which that particular patient is suffering with. At least keep your mind 2 minutes. You should be just relaxing. Why? Because you'll never know in what direction the discussion will move. Sometimes you should be you may be in a position to recall something from very remote memory. So for that your mind has to be absolutely free. If you are preoccupied with some last minute revision of some classification, some figures, some numbers, what happens is that the ability for recall of past memory is curtailed. So these are the tips for the exam. That's number one. The clinical examination is important. There are instances where the examiner may reach up to the patient and try. Never miss out fundus examination, looking for the cardiac effects, a proper palpation of the abdomen. Basic is always basic. Examination of the genitalia, particularly neurogenic bladder, perianal anesthesia, perineal anesthesia, and so on. That is all important, So examination of the genitalia, description about it. Suppose the examiner says, just tell the positive findings. That's fine. Sometimes, some examiners may be very particular whether you are methodically examined. And also, you are supposed to do urine examination. If it is not done, at least they will give the report, urine report that has been incorporated in the lung case. That's very important. That's about it. And coming to, Dr. Swarnalatha said, some tips on the how to practice nephrology in life and so on. So that is a very big question. The thing is that you all have a kind of a challenging and great career ahead. Why I am saying that is, India is still in need of more nephrologists. The way the CKD is growing tremendously, leaps and bounds, still we don't have enough hands. So you all will be very busy and you all have a great role to play as nephrologists. Number one. Number two, identify your area of strength. Stick on to that. You need not be in the rat race. Somebody does something, I also have to do. No, not that. You identify your area of strength and keep doing it. And wherever you are, please have some touch with an academics. And please keep documenting properly. And please create a mechanism to kind of collect and collate your data. So data maintenance is very important. In the years to come, a lot of collaborative studies are happening. Even if you are a single nephrologist practitioner, you may be part of a collaborative study. So maintain data, digitize your data, and keep publishing. You can keep publishing even as a private practitioner practicing as a solo nephrology. Why I am saying is that, initially that excitement will be there until you get a good practice, you think that is the end of it. After, in no time, you'll become a busy practitioner. Even then you'll be happy. And after some time, there'll be a vacuum. You may get bored with what you have been longing for. Oh, after life this much. So if you have side by side some touch with academics and a little bit of research, you'll never get bored. And another important thing is that as nephrologists, I feel, including myself, I am feeling very guilty that I have not fulfilled the mandate of passing some basic information pertaining to kidney care, kidney health, to the common man, to the primary level physicians and secondary level physicians. That is our duty. Be part of IMA wherever you are. Keep giving lectures regularly, however busy you are. That is a great service. Do simple do's and don'ts. There are so many mistakes do happen, ultimately resulting in kidney failure. So that is part of it. And then, at least once a month, reach up to the common man. A preventive nephrology at the field level, that is very, very important. Because certain parts of India, particularly Tamil Nadu, Andhra, Telangana, Orissa, certain pockets of Maharashtra, CKDU is emerging as a major problem. In Tamil Nadu, 50% of CKD is CKDU. So there are two problems. One, hypertension, diabetes, obesity complex. The other one, CKDU complex. The CKDU, the common man, the people who are working in unorganized sector, they are affected. The poor peasants, working in agriculture and construction workers. You have to create some time and allot some time for the welfare of those poor fellow citizens. Thank you, and may God bless you all with a wonderful career ahead.
Actually, after listening to the case presentations today, what I felt was it is the stress you people are experiencing more than anything else. Though you are well endowed with the knowledge, though you know what to do and how to do, you are really overwhelmed with the stress at that point of time. So there is no need of stress at all, as Sir told. Just relax for some time and present. You know everything. But then at the point of time, you are not able to express yourself. That is the main thing. So try to overcome that stress and try to present well. All of you are well endowed with the knowledge, and you people have seen so many cases all 3 years, struggled, slogged, and endowed with knowledge now. So there is no point in getting stressed at this point of time where you have to express yourself. So overcome that stress, and all of you will do well.
Final word from this, sir? But be brief.
Be brief, okay. That should be there automatically. So I know that it's a great opportunity for you people to sit here for 2 days and learn from the teachers along with your colleagues. It's equally important for you. And now you understood what are all your drawbacks, deficiencies and the lacunae, where in your understanding, the concepts and the presentations and writing the case sheets and exposing it to the examiners in everywhere and every sector. I think it's a time for you people before the examination. There's a good amount of duration is also there. Before the exam, go back and reanalyze yourself and introspect and retrospect and see that all your mistakes are being corrected over a period of time. Before the examination, the final examination, I hope that you will bounce back and you come with a great colors and present your cases and get the laurels to you along with the institution and your teachers. And good luck to all of you.
So anybody from you want to express what was your experience? In fact, madam first day told, I want feedback from the students because madam has to improve, it seems. So that's why madam's what do you call enthusiasm in making her update, and then so that was the first day madam has given me the feedback. So any feedback from your side?
Good evening. Thank you to all the teachers. Style of questioning of each examiner, and we enjoyed it thoroughly, ma'am. Only positive feedback, nothing else.
No, you can give negative feedback also. We'll
Nothing.
take it.
There is no negative feedback. Yes, ma'am.
For this initiation, it's a great initiative, not only for you people, for us also. Being with Dr. Vinay Sokhisha sir, he was my teacher. Very grateful to be besides him and sitting besides him as an examiner. That was a lifetime opportunity. Ma'am, Dr. Vimla ma'am and Dr. Gopal Krishna sir, very, very knowledgeable persons. Thank you very much. And hope to see them in future also for the mock exams. Thank you.
Anybody from other institutes? Usmania, Gandhi? Yes, please. You are representing Manisha. So you have in any event in
Learned a
Hyderabad?
lot, ma'am. Thank you.
Gandhi? Anything? Yes, please.
His voice from Gandhi.
The last one from Gandhi. Any DNB candidates here? Yes, please. You can also express your thoughts.
Uh, Thank you. I want to thank all the teachers. It was a wonderful session. We actually learned a lot. We are trying to, there is a stress. Now we are experiencing that stress here. Hope that stress won't be there in final exam. Thank you. It was wonderful teaching, sir.
The purpose of this mock is that only. To get rid of that stress.
Very,
To face you with the more strict examiners, so that your final examination can be like smooth.
major thing we learned is that how to approach. We have to learn how to approach the case rather than a case. That is what we tried.
Not at all important. Approach. The exam organizer from that team, even if somebody wants to skip you with the diagnosis, please say, don't.
Thank you. From DNB candidates, please. There are DNB candidates also there. No. He's from Gandhi. Gandhi. Kimsa? Okay. So don't want to comment? No. Vijay and Mukesh, because they have been doing a lot of background work. And Dr. Fanishri, she's sick. She became so sick organizing all this, she could not attend actually on the D-Day. So thanks to you people for doing the all background work. Just two things I want to add. Don't be so casual. Now that examination day, you are very casual in front of examiners, they get irritated. That's one extreme. And the other extreme is like, don't underestimate examiners. So Madam said, you have to be smart enough to drag into your court. But examiners are smarter than you. So they will identify if the field which you don't know, they'll drag you there and try to fail you. So be in that boundary, your limitation, okay? And beyond this education examination, why I said that, because most of these youngsters, they don't know how to, basically very challenging happens when they go to practice after examination. This is like program platform. So you are all trained, tuned, and everything negatives, they are there to protect you. But once you go outside and practice, then you'll face the real challenge. So that is the real examination, not this examination. So
everybody will pass through a transient phase of uncertainty. That time you should not get deterred by any adversity that comes along. You just learn to relax for some time. You have to be waiting for your day to come. Don't be in a stress.